discuss about postpartum depression. So as many people know about postpartum depression and some people won't, so we'll discuss about how generally happens in the what generally happens in the postpartum depression. So mother, after the childbirth, mother feels so exhausted. Okay, lots of issues, lots of mood swings, lots of anger issues are there. Okay, so generally what happens, if the situation persists for a few days, it's normal. But what if the situation persists so long, after 1 or 2 months, it is like that, so we consider it as a postpartum depression. So what generally happens in the postpartum depression, the mother is so exhausted, the mother feels so lonely. The symptoms may you see the irritable conditions, the mood swings, the anger issues, forgetfulness, lack of attention, lack of concentration. These are the symptoms by which we can predict the suffering of a mother in that condition. So we generally divide this psychological condition in 3 different parts, in which the first part you see is a psychological blues, which is often, okay, it's very normal, but a little bit of mood swings we generally see in that condition, but not very severe. It's not very severe condition, it's a blues. Sometimes it happens, sometimes it's normal, so it's a blues. And the second one, which is a little bit of danger thing, which is a postpartum psychiatric disorder. इसमें क्या होता है, postpartum psychiatric depression disorder, इसमें क्या होता है, what generally happens in this condition, the people are show extreme behaviors of themselves. Okay, the behavior is so extreme, the mood swing is so high, the people feel so much irritation, so much anger issues, and lots of cries, and lots of drama is there. Okay, the psychiatrists give them a pill to calm them down. If the situation get so much worse, then the patient need to hospitalize even. Okay, even they need to hospitalize in that condition. So what are the causes? Okay, why it happens? You see, why it happens? So some mother is so less in their age. Okay, so generally what we see, if the patient or if the mother is conceiving the baby before after 20 or before 35, then it is good. Okay, conceiving the baby in that age is normal and it is good. But what before 18 and after 35 is a very serious issue. Okay, the people need to, people suffer in sometimes not, sometimes it is risky to conceive baby after 35 and before 18. So what generally happens, if the patient is suffering so much harsh condition in the home, like financial conditions or any conflict with the spouse or any conflict with the family members, family dispute or anything like that, or if the partner is additive, so these can make the situation more worst. So understanding partner and understanding family are the key factor which generally avoid this kind of scenario to the mother. So what makes it more worst? What makes it more worst? So sometimes we generally see that mother wants to harm herself along with the child. So this is the serious condition. So in that condition, you need to consult with the suicidal helpline or lots of helpline number, psychological helpline numbers are there. You have to consult your doctor first. You need to consult your doctor. So whatever you are feeling, just convey to your doctor, and she will tell you what to do. So one thing you need to understand, what will you do? First thing first, what will you do if the situation persists with some mother? So what you will do? What's your first thing? What will you do? What things first comes to your mind when you see some mother suffering like that? So you need to understand that you have to tell to them that go for a morning walk in a morning sunlight with the baby. You have to connect with the baby at that time. Okay, sometimes people won't accept the baby because there is hell lots of hormonal imbalance, hormonal change. The hormones drastically falls after the birth of a baby. So the estrogen level and the thyroid hormones also plays very important role in this condition. So thyroid increases or the decreases, whatever the situation. So people feel extremely fatigued or they feel exhausted. So what will you do? You have to cut off all your extracurricular activities for some times, because it's your time when your body is healing. Okay, 1 or 2 months are the time after the birth of a baby. That's your healing time. It's very crucial. So you need to cut off all your extracurricular activities for 1 or 2 months so that your body gets settled. You have to adhere to the exercise or whatever suits you. If yoga suits you, well and good. If exercise suits you, then do your exercise, adhere to your exercise, adhere to your morning walks. So these can help. You have to cut off all your nicotines. You have to avoid all your psychotropic drugs so that your mind and the body won't contaminate from them. So, and the baby also feels safe around. So these are the things which generally we see in the post